Asthma is one of the most common inflammatory diseases. Approximately 300 million people worldwide currently have asthma, and its prevalence increases by 50% every decade. The main goals of asthma treatment are to control the symptoms and reduce the risk of asthma attack. In order to control your asthma, you need to identify your triggers and take a step to avoid them. Make sure your medications are acting well and control the disease properly, because it can cause irreversible damage to the airways if left untreated. There are three essential components of asthma management. The first one is to avoid things that trigger the disease. Avoid triggers that flares up the asthma plays an important role in controlling the symptoms. The most common triggers include weather, especially sudden change in temperature, cold and humidity, smoking, allergens such as pollen, animal fur and feathers, and pollution. Some special medications like non-steroidal anti-inflammatory drugs such as ibuprofen and aspirin, infections like cold and flu, emotions especially stress, some special disorders such as acid reflux of the stomach, and exercise can be a trigger item for some people. In some cases, asthma is associated to substances that you may be exposed to at your workplace or anywhere else, like wood dust, isocyanates, which is commonly found in foams, flour and grain dust. Once you know your triggers, trying to avoid them may help control your symptoms. The second measure of controlling asthma is monitoring for change in symptoms, in order to take more supportive measures for controlling them. And finally, treatment with medications will be needed to reduce the inflammation, prevent asthma flare-up, and keep the symptoms under control. Currently, there is no cure for asthma, and treatment is just to control the symptoms. Asthma manifestations differ from person to person and depend on a number of factors like triggers, age, and severity of symptoms, so the treatment plan changes for each patient. There are four main types of asthma medications. Quick relief medications work fast to stop coughing, wheezing, and shortness of breath quickly. Most of these drugs are inhaled and go straight into the lungs. This medication relaxes the muscles around the airway and helps widen it, so the air can better move in and out of the lung. The most common quick relief medicine is inhaled albuterol or salbutamol. If you need to use this medicine more than 2 days a week, means your asthma is not controlled. Controller medications are usually required in addition to quick relief medications to keep symptoms under control. They reduce swelling and mucus in the airway and are the most important medications for long-term control of asthma. They generally taken 1 or 2 times daily. Many people with asthma need to take long-term medications even if they don't have symptoms. Inhaled corticosteroids like budesonide, mometasone, and fluticasone, inhaled long-acting beta-agonists such as salmeterol and formoterol are most common medication in this type. The third category of asthma medications are combination of an inhaled corticosteroid and a long-acting beta-agonist together, because many asthmatics need to take both together, so the combination of them is an easy way to do it. Leukotrienes modifiers relax the muscle around the airway and reduce swelling. The most common medicine in this class are montelukast and zafirlukast. There are some alternative treatments that can help with the symptoms, but never forget that these treatments are not a replacement for medical treatments. Alternative treatments include herbal and natural remedies include black seed, ginger, and omega-3. They can reduce inflammation and alleviate the symptoms. Exercising and playing sports can actually lessen the symptoms and improve lung function. Work with your doctor to choose the best exercise plan. Don't forget to follow your doctor's advice to manage your asthma, because the wrong plan may worsen your symptoms.